CNA practice test with answers. Welcome to the quiz. Question 1. You are working on a psychiatric unit and are caring for Mr. Vincent Ryan, a 45-year-old male patient who has a diagnosis of major depressive disorder. During your evening shift, he tells you that he has been having thoughts about wanting to hurt himself and that he does not believe his life is worth living. He appears hopeless and mentions specific plans about how he might harm himself. You understand this is a serious situation. Based on proper procedures for responding to patients expressing suicidal thoughts, how should you respond? Option A. Tell him that these feelings will pass and that he should not worry about them. Option B. Explain to him that suicide is morally wrong and that he should not have these thoughts. Option C. Remain with the patient, provide reassurance and support, and immediately notify the nurse and other appropriate personnel so that appropriate evaluation and safety measures can be implemented. Option D. Document his comments in the chart and address it with the patient later after you have finished your other tasks. The answer is C. Suicidal ideation requires immediate intervention. Stay with the patient, provide support, and notify the nurse/crisis team. Option C is correct. Options A and B dismiss his feelings. Option D delays critical action. Question 2. You're working on a unit where several patients have infectious diseases and are on various types of isolation precautions. You are learning about how to identify when isolation precautions should be discontinued. One of your patients has been in contact/droplet precautions for respiratory infection. Based on standards for infection control, when should isolation precautions be discontinued? Option A. Isolation precautions should be stopped when the patient requests them to be discontinued. Option B. Isolation precautions should be discontinued when ordered by the nurse or physician based on test results, clinical improvement, or time-based criteria specific to the organism. Option C. Isolation precautions should automatically be stopped after 1 week regardless of the patient's condition. Option D. Isolation precautions should only be stopped when the patient is discharged from the hospital. The answer is B. Discontinuation of precautions is a medical decision based on specific criteria. Option B is correct. Options A, C, and D are not appropriate. Question 3. You are assisting Mr. Henry Martinez, a 75-year-old patient, with ambulation in the hallway. You are supporting him with a transfer belt around his waist for safety. Suddenly, he tells you he feels dizzy, loses his footing, and begins to fall toward the floor. You realize that you need to respond immediately to prevent a serious injury. Based on appropriate response to a patient who is falling, what is the most appropriate action? Option A. Quickly grab the patient to stop him from falling, as this is the most important action. Option B. Remain calm, try to break the fall and slow his descent if possible, ease him to the floor gently if a fall cannot be prevented, and call for help immediately. Option C. Wait to see if the patient can catch himself and get back up on his own. Option D. Move the patient immediately after he has fallen to get him off the floor. The answer is B. When a patient falls, do not try to catch them, risk injury to both. Instead, ease them to the floor, protect their head, and call for help. Option B is correct. Option A may cause injury. Option C is dangerous. Option D. Do not move a fallen patient until assessed. Question 4. You are assisting Mrs. Violet Thompson, an 80-year-old female patient who wears dentures. She is unable to care for her dentures independently due to arthritis and mobility limitations. Her dentures are not currently in her mouth. You need to properly store her dentures. Based on proper denture care and storage, how should dentures be stored if a patient cannot wear them? Option A. Leave the dentures on the bedside table without any cover or container. Option B. Place the dentures in a labeled container with water or denture solution to keep them moist and prevent damage and warping. Option C. Put them in any available cup with tap water without labeling or specification. Option D. Keep the dentures in the patient's pocket where they are easily accessible. The answer is B. Dentures must be stored in a labeled container with water or solution to prevent drying and damage and to avoid loss. Option B is correct. Options A, C, and D risk damage, loss, or contamination. Question 5. You are reviewing laboratory results for your assigned patients. One of your patients, Mrs. Alice Johnson, has a urinalysis result available. When reviewing her result, you notice that her urine appears cloudy. She reports burning sensation with urination, and she is having more frequent urination than usual. These findings are consistent with certain types of infections. Based on recognition of signs and symptoms of infection, which observation would indicate a patient may have a urinary tract infection? Option A. Clear urine output with good urine color. Option B. Cloudy or turbid urine, burning sensation with urination, increased urinary frequency, and urgency to urinate. Option C. Large volume of urine output each time the patient voids. Option D. Absence of any urine output for several hours. The answer is B. Classic UTI symptoms: cloudy urine, dysuria, frequency, urgency. Option B is correct. Clear urine is normal. Large volume is not typical. Absence of output is anuria, not UTI specific. Question 6. You are reviewing documentation for one of your patients. You read about a patient incident that was documented in the chart and notice that the documentation was done carefully and accurately. You understand the importance of good documentation for legal protection and quality care. Based on standards for proper documentation and the importance of documentation for patient care and legal protection, how should you document patient care for legal protection? Option A. Use vague and general terms to avoid being too specific about what happened. Option B. Document objectively, factually, in a timely manner, legibly, including accurate details about what occurred. Option C. Option D. The answer is B. Proper documentation is objective, factual, timely, and legible. Option B is correct. Option A is incorrect. Vagueness is not legally protective. Options C and D are missing in the PDF. Great job! Don't forget to subscribe. Bye.